Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
Thanks for joining me. A patient came in with a toothache in the upper left. It's this tooth number 13 that has a custom post and root canal and crown on it. There you can see where the abscess is. So after going over some options, patient decided to get it extracted and, if we can, have the implant placed in the same visit. So get her nice and numb, also have her on some nitrous oxide because she was a bit nervous. And now I'm just going to extract the tooth, and I'm using my favorite extraction instrument, the spade proximator. And in this case, because we're trying to preserve the socket and not have any damage done to the bone, because I'm hoping to place the implant the same visit, I'm using the spade proximator more like a periotome. So that means basically I'm just introducing it up in between the tooth and the jawbone, trying to cut the ligaments, the periodontal ligament that holds the tooth in place. So I'm going to work it around. I don't have a lot of room to work in. It's pretty close to that molar with another crown, and then the other premolar has got a pretty big filling in there. So you got to just take my time, be nice and gentle, loosen it up before we put any forceps on it. And hopefully we can do an immediate implant, because putting the implant in the same day that you take the tooth out actually saves quite a bit of healing time. For an upper tooth, I allow about 4 months or so after a tooth is removed for the bone or the bone graft to heal. And then once that's healed and then we go back to place the implant, it's another 4 months. So it's 8 months of healing before we can even start working on putting a crown on the tooth. So now I switched over to my luxator. It's a little bit thicker, not as thick as a 301, but I got it moving enough. And now I can hopefully just grab the tooth with my apical retention forceps. Sometimes in this case, when there's a crown on a root canal tooth, especially with a big custom post like that, the crown will come off, the post will come out, but the root will still be in there. But in this case, it appears everything's moving, and there we got it. So I just like to check it, make sure we got it all out in one piece. So again, by placing the implant this visit rather than waiting 4 months for it for the bone to heal, we're saving 4 months of time for the person. Now, for the average person, it may not make a difference. This patient's actually 85 years old, so she wants to get her tooth as soon as possible. So now I'm just going back in there with my curette, removing that dark area that you saw on the x-ray. It's an abscess. It could be a little bit of a cyst forming from the body, basically just some soft tissue up there. I want to remove all that soft tissue from in the socket and just leave it as clean, healthy bone, because we don't want to leave an infection up in there that can cause an infection in the dental implant once we place this. Another nice thing about placing an immediate implant in a single rooted tooth like this upper premolar is that most of the drilling work is already done for the dental implant. There's already a hole there. We just pretty big, pretty deep, and then we just need to kind of shape it for the implant. Now, since I am going to be using a bone graft, I use a material called Synthograft. It's beta tricalcium phosphate, and it's recommended that gets mixed with the patient's own blood. So I'm just collecting a little bit of the blood. And I'm going to be placing a BioMax Forte implant. It's made by a company called Blue Sky Bio, and it's got very nice wide threads on it, which you'll see on the final x-ray, which gives me a lot of stability. So I just use that one drill to basically shape the hole, to give it the proper dimensions, and also to deepen it a little bit. And there you can see now I had mixed up the Synthograft with the patient's blood, so that's why it's kind of pinky red, and I'm just loading it into my bone graft syringe, so that makes it easier to inject it into the socket where it needs to be. So I'm just tapping it into place, and since I had prepped, now I always like to start off my implants with my fingers. I know a lot of people can use it with the drill. For some reason or another, I just like doing it that way. I also do a lot of car repair and restoration, so maybe it just, for me, whenever I start a screw or a bolt on a car, I always do it by hand first to avoid stripping or cross-threading. I know it's not something you got to worry about in a tooth, but yeah, for a dental implant, but it's a carryover. And then once it gets too tight for me to use my fingers, I'll use my torque wrench to drive it home to seat it down. So for these immediate implants, BioMax Forte implants are designed to be placed 1 millimeter subcrestally, so that a millimeter below the crest of the bone. So what I like to do is I like to place them basically about 4 to 5 millimeters below the crest of the gum, because the idea behind it is that when you're placing it, once you go to restore the implant's going to need a biological width of about 3 millimeters plus that 1 millimeter below the bone, so you got 4 millimeters. And there we go. We torqued it in, and it had enough torque so that I was able to place the healing abutment, and that's that part you see. Let me circle that. And in this way, that'll also save me some time down the road after everything's healed. So once this implant is healed in about 4 months, we'll just come back, unscrew that healing abutment, and then I can place the impression post and take an impression of it. And now let me point out what makes the BioMax Forte implant different. So this is, I'm not sure, but I think it's a design that they copied off of either the Bicon implants or Megagen implants, but it's got these very wide threads around the body of the implant. So there's the central body of it. Let me point that out. And then that's the main body of the implant itself. And then it's got these threads that go all the way around it. And those threads are great because in a situation like this, where we have where we're placing an immediate implant into the socket, those threads can dig into the bone of the socket and help stabilize the implant and lock it in place without the need to having to place like a really, really wide implant. I believe this is a 5 millimeter wide implant, 5 by 8 millimeter BioMax Forte. So been very happy with the implants, been very happy with the whole BioMax lineup. So there you have it. All right, thank you guys so much for watching. Hope you enjoyed this little video. Any questions or comments, please leave them down below. And we'll see you guys in the next one. Thanks. Bye-bye.